All right, welcome back, everybody. This is Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and I am the host of Plastic Surgery TNA. That's Talking Advice, and it's on YouTube every Saturday after 11 p.m. or excuse me, 11 a.m., not 11 p.m., 11 a.m. Eastern Standard Time. And I appreciate your returning viewers. I really appreciate you supporting the channel. And if you're new to the channel, I really want you to do one or two things. I want you to share this. If this episode or any of my episodes speak to you or speak to somebody that you know, and I would like you to subscribe to the channel. It will really help me grow the channel. I know I've been saying that forever and a day, but it does help me grow the channel so I can have a special program like I have today. Today, I actually have a guest. You don't have to listen to me just talk, 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 talk. We have a very special guest, and I'm so happy to have her here. Her name is Nurse Tay, and she is a post-operative nurse for plastic surgery, and she's based in Atlanta, right here in the ATL. So without further ado, I would like to introduce Nurse Tay. Hey, how
Hi.
you doing?
Good. How are you? Good to
Doing
see
great, doing great.
you.
Thank you so much for taking the time. I know you're super, super busy, and I really appreciate you spending a little time to kind of chat with me and kind of educate me and educate, my followers about what you do. So on that note, tell us a little bit about yourself and your business.
Okay, thank you. Thank you so much for having me. I
Of
truly
course.
appreciate it. It's always great to connect with providers like you who actually care about what they do, care about the safetyness and the overall result and well-being of a client getting a cosmetic procedure. So thank you for everything that you do within this industry.
I appreciate that. I really appreciate that. So yeah,
Okay.
tell us about yourself and tell us about your business.
All right. So I go by Nurse Tay. A little bit of my background. I am a ER emergency medicine registered nurse. I've been doing that for about 11, going on 12 years now. It's up for me to renew next year. My background mainly is in that. However, I also have some experience in outpatient PACU, in hospice, and in wound care. I transitioned or I'm transitioning out of bedside. I started my own business where I provide post-operative care for clients who have cosmetic surgery. I've been doing that for going on 3 years now. And the whole idea stemmed from me having my own cosmetic surgery procedure.
Okay.
I had lipo 360. And even though I'm a registered nurse, I had no clue
Okay. Right.
what I was setting myself up for, what the process and the journey was going to be. And the whole time I'm experiencing everything. And I'm like, man, if I'm a whole licensed medical professional and I did not know all these things, imagine the lay client or someone who does not have a background in the medical field. What are they going to know? What do they need to expect? So that inspired me to do my market research, see how many nurses were doing it at the time. I did what I needed to do to get my certifications, and I started my business. So along with that was my journey. I did an advanced class, which now I can legally call myself a nurse and a therapist. So I am actually a certified manual lymphatic drainage therapist, meaning not only can I manage post-operative clients, I can also maintain patients and or clients with about 20 other medical conditions, such as lymphedema, edema, arthritis, some abdominal diagnoses as well. But I stick with post-op. That is my lane. That's what I found out I like. But it's nice to have that cushion of expertise and knowledge. And it does help with me aiding in the complex clients that I receive.
Oh, that's awesome. That's a great story. So your story is really born out of really personal experience. And
Yes.
so that's interesting. So when you were undergoing your journey, and like I said, you're trained, you've got the background, you've got the knowledge, you think this is a slam dunk. So you're going through the process. Give me just a couple of examples where you're going, I wasn't expecting X or I wasn't expecting Y. And if I had the chance, I would do this. So kind of walk me through a scenario like that.
Oh wow. Okay. So from the beginning, the company that I kept during the procedure, I took two of my homeboys. Like that's how
Okay,
much I did
gotcha.
not take it
Right.
serious. Now, one was a nurse. Okay.
Okay.
One was a registered nurse. So I
Okay.
wasn't too far out. However, in my mind, I'm like, oh, it's just lipo. I'll be fine. You know, we're gonna go down
Sure.
here, get this done. I'm gonna come back and everything's gonna be fine.
Right.
Everything was not fine.
Okay.
I woke up, it was mainly the pain. I was
I see.
not expecting, honestly speaking. I did gauge the liposuction of previous surgery. So I've also had a breast implant and breast lift.
Okay.
And the recovery was easy peasy. Like I tell
Gotcha.
anyone, if you can go through lipo, you can get anything pretty
Yes.
much.
Right. Right.
But I didn't know that, prior to scheduling it. So I remember waking up in the PACU screaming,
Oh
not
wow.
like in horror. It
Right.
was just I was not expecting to feel the way that I felt.
Gotcha.
Um, I also I did the right thing as far as taking off the amount of time for work, but
Okay.
I didn't realize how long it took to get back to normal, if you will, as
Yeah.
far as the stiffness and the discomfort. I really thought I would be further along than what I was. And I realized like this is a pretty serious thing. So I just took those types of things into consideration. Also, supplies needed around the home to have a
Sure.
successful journey with the drainage. I didn't even have enough chuck pads that I should have had. Thinking
Right.
about things about the car ride.
Yeah.
Now
Right.
we had a rental car. I didn't have anything to protect the car to
Oh
go
my
home.
goodness.
So it was like little things like that. And I'm like, wow, this is a lot more than what I thought it was going to be. There's other people that need to know so that they can be more prepared and have a successful journey. I did everything I was supposed to do as far as
Right.
my post-op person. So that was not the issue. It
Right.
was the expectations of the procedure. And I
Right.
realized that too, is that people take lipo very lightly.
Sure.
And it's not a light thing.
No, it's not. And I'm going to say from my end, it's a bit of our fault.
Mhm.
From our end, we just kind of go, oh yeah, because on my end, I'm used to doing it every day. I take care of people. They have it done. They go through their process, and you just get a little snippet of when they walk in the office. Oh, I'm in
Mhm.
pain, dog. Or can I do this? But I don't get the whole story. So I then kind of say, well, it's not probably that bad. And I just don't give them all the information so they can negotiate daily activities. And so I think it's a little bit of lack of education on our part. So that's why it's great to partner with somebody like you,
Mhm.
who one has had the experience personally, and now two can take that and then implement that to my patients or other plastic surgery surgeons patients and say, hey, look, yes, you're going to have the procedure. Yes, you're going to be better, but let's talk about, like I said, the ride home. Who's bringing you? Is the car comfortable? Can you lay back? Do you have enough
Mhm.
pads? Is it going to
Mhm.
be bumpy? What time is it? What time is the traffic? I mean, you got to plan for all these things. So
Yeah.
I think that's really helpful. So it's great to have someone like you in the community because, like I said, plastic surgeons, I don't think really think globally in that sense. We're more worried about, is it a good candidate? Are they going to have trouble? Are they having trouble? Can I get them safely to the end? So
Yeah.
awesome, awesome. So now in your company or in your business, you do lymphatic massage, and correct me if I'm wrong, you
Mhm.
do IV post-operative therapy, you do
Yes.
compression recommendations or compressive therapy, and
Mhm.
body wraps. Is that
Yes.
correct?
Correct.
Did I
Correct.
miss anything else for your core business? Is that kind of
Yeah, so as far as like the base of the post-op, that is the base of it. Outside of the massage, I can also maintain anything else you may need within your care. Like if you need your stitches or your sutures removed, your
okay?
surgical drain removed. I also can manage seromas, treat them, and aspirate as well. And
Okay.
minor wound care. I partner with a nurse practitioner who does our complex wound care.
Oh, awesome, awesome. We'll maybe touch on that a little bit later because I think that's a big component. I think a lot of people get surprised that some of these procedures, especially the ones you have to make an incision, can end up with
Mhm.
some wounds that need to be kind of doctored along. So
Yep.
let's talk about kind of the core component. I think most clients are probably familiar with now
Mhm.
is lymphatic massage. So that's a hot thing. So in my arena, we don't get any training about that. I'm just
Yes.
gonna be real here. There's no lymphatic massage. book for us. There's no training in residency. We're learning just like everyone else is learning. So some surgeons like it, some surgeons don't, some surgeons like it at a certain point. So tell me, one, why is it important? First of all, so why is lymphatic drainage or massage important?
So it seems to be like you mentioned before. Let's say if someone's had surgery 10 years ago, this was not mentioned at all.
Right.
However, now things are changing and they're recognizing the lymphatic system as a wonderful aid in surgical recovery in general, whether
Okay.
it's plastic or not.
Yes.
So even in a hospital setting, because I still work as an ER nurse,
Okay.
we use that thinking process to help people and aid in their healing if they come with a complaint as such. So the lymphatic system in its medical definition is wonderful for fighting infection, decreasing inflammation, and filtering any toxins or additional fluid outside of your body. So by getting a lymphatic drainage massage done correctly, sometimes after cosmetic surgery, there's residual fluid that needs to be drained. Well, that massage helps to facilitate and filter it throughout your body system properly and expel in the right way so that you develop naturally. It also helps to decrease with the pain and inflammation and swelling in the beginning, and it can prevent fibrosis, which is a major thing that can happen after having surgery, mainly liposuction. You want to have a smooth, flat feeling surface. You don't want to look hard and lumpy.
Sure.
So sometimes if that fluid is not filtered correctly, or if one does not get enough or any massages at all, that fluid begins to harden and build up and does not give you that smooth, even surface that you
Okay, excellent. Now, from my understanding, and again, it's limited. That's why I partner with you, and you educate me so we can educate my clients. Is this something that was kind of born out of the U.S., or is this something more kind of was international first, and we as U.S. citizens kind of adopt that, or surgeons adopt it? What's the kind of the brief history? I'm not trying to make you have a history.
Oh, no. Yeah, so it was originated internationally in the Dominican Republic, in Colombia, as with the BBL. It's kind of how it all came into existence to begin with. So they have their own method. Their timeline of doing things is quite different from what we deem over here, because we have different rules that govern us as far as the medical field of how things can be done. But they definitely hone in on starting sometimes the same day with massaging people, because it's that important to get them. I understand their reasoning. It's very important to get them to a certain space before they return home, because honestly speaking, we don't know what some clients are going to do. If they follow proper protocol. So they go hard on them. In the beginning. And honestly speaking, they're over there for 2 weeks to a month. Majority of the clients will be over there for 30 days before they even come back. So they kind of accelerate and take things to the next level over there. And then it's on the responsibility of the client to find someone back in the U.S. in the area to carry on with that.
Gotcha. So let's say we got someone who's right here in Georgia, and they're not going over and doing it abroad. What's your recommendation for someone who's had liposuction, or maybe a tummy tuck and liposuction? How soon do you like for the client to engage with lymphatic massage?
Okay, so it honestly depends on the procedure.
Okay.
The most easiest for breasts, believe it or not, they are actually beneficial for breast augmentation, especially your breast lifts, because your lymph nodes up here, you want to filter that to the right area. I have had some clients from other providers who actually built up fluid behind their wall cavity, and I've had to go in and aspirate that. So a lot of people don't know, even if you get your breast done, you still can benefit from a lymphatic massage in the from the head, neck, upper chest area. It's not as extensive. You don't need that many. So that's the lighter end. And we can start as soon as the doctor says you're clear. First of all, speaking, I stay in my lane and my scope of practice. Even though I'm now an independent contractor with my own license, I always ask the client, well, what did your surgeon say? If it's something that I can agree with, or we can come midway, I'm like, okay, I can wait. If they're saying something that really does not serve the client any justice, I do have to kind of intercept and say, well, from my experience, what I see with this procedure, it should be done like this. So with lipo and BBL, we can start as early as the next day if the
Okay.
surgeon is okay with it. A lot of other ones are placed to do. So I always ask that. Sometimes, which was my case, when I had lipo, I was in very uncomfortable the next day. So I didn't feel like I could tolerate anyone touching me.
Sure.
The masseuse did come over and he saw my face and was like, no.
No. Right.
Literally didn't even walk through the front door.
Right. He's like, nah, not
yeah,
today.
you need to rest. So I do that now with mine. I actually ask them, clients who call me ahead of time, I'm like, we can tentatively say the next day, but I'm going to see how you feel first. You may need a whole day to rest. If so, then we'll start day 2. Tummy tucks. I'm very sensitive with those clients because of the incision line of the tummy tuck. For all I'm speaking, surgeons don't know every post-op provider out there. They don't know who the client is going to. So I do not have any issue if their surgeon says, hey, I would like for you to wait at least 2 weeks before getting massages. I'm okay with that. I can start the next day. I know what area to stop so that I do not compromise the healing of the line, but every other person doesn't. That would be the only time when we will wait, further than 2 days. For tummy tuck, I always ask, is the surgeon okay with me starting in a few days or the next day? If not, if he wants me to wait, I will do that. But we're going to pay attention to your discomfort, your swelling, and the possible fluid buildup. Sometimes the client literally cannot stand it. They need just some little manipulation. And I can work around that and do that as well.
Okay.
Until the surgeon is comfortable with me doing a full massage.
Got you. So obviously, what I hear you saying is you're really collaborative, and I know that. But for our audience, you're really collaborative and working together with the surgeon as a team to make sure we kind of get the right recommendations based on what the client needs and where the client is. That's what I hear from you.
Correct. Sure. Even if I don't talk to them, like me and you have a relationship, but there's plenty of clients I don't talk to them. The client is responsible for communicating with the surgeon. And
okay. Good to know. Good to know. Good to know. And I learned something. I didn't, and I learned something. I didn't know that lymphatic massages were beneficial for breasts. I mean, it makes sense to me when I kind of take off my cosmetic hat and put on my reconstructive hat from breast reconstruction and taking out the lymph nodes and all that. It makes sense to me, but I never really put that together for breast lift, breast augmentation. So good to know. Good to know. Good to know. So that's good information. So it sounds like lymphatic massage is becoming more popular in the US. Surgeons, I think, are getting more comfortable with it. I still think you probably have to battle myths and misinformation. What are some of the myths that you've heard, and can you shed some light on those?
Yes. So the main thing, as we discussed before, is some surgeons, aren't favorable to them. So sometimes they were told, well, you don't need any massages. That is what I counter. I'm like, that's not true anymore. You actually do. It will help you so much more than what you think. Also, the amount of massages. What I tell people, honestly speaking, is when you want to have a cosmetic surgery procedure, you definitely need to think about the aftercare because it's also just as important depending on what you've gotten. So for some people, they don't assess that part and they're kind of in a strain because they need to get these services done, but they can't afford it. So some don't count the cost, honestly, of having a cosmetic surgery procedure. As far as the medical side, oh man, with the breast is not having someone look at your areola or your nipple, especially with the lip. I need to see them. I don't have to touch it. I know it's dished up, but I need to see that nipple to make sure that the circulation is coming back because we have a time window. After that.
Yes, and that's a devastating complication that nobody wants to get close to, for sure. On my end, as well as just for our audience, when we're doing breast surgery, the key thing, obviously, we want about shape, we want about size, but everything revolves around keeping the nipple healthy and alive,
Yes.
no matter what the goal is. And
Yes.
sometimes we can't even really reach the goal, and that's not the time to decide on the table, but we try to have those honest conversations up front.
Mm-hmm.
Hey, I hear what you want, but that's going to jeopardize the nipple, because at the end of the day, losing a nipple is devastating for obviously
Yes.
the surgeon, but it's it's a catastrophe for the patient. So
Yes,
I
definitely so. And
totally agree.
also too, sitting on your butt with a BBL.
Yes,
Everybody has their time frame. You'll hear some clients that'll say, "Well, I sat day 3 and I was fine." I'm like, "But you can't tell somebody else to do that."
sure.
You know what I mean? You could compromise someone else's results from them listening to you.
Absolutely. Yeah, you have to individualize that. I mean, you can get the lay of the land from other people who've had surgery, but their surgeon who performed surgery for them knows how he or she handles it, knows what the outcomes are, and you have to follow those recommendations for sure.
Definitely,
For sure.
definitely.
For sure. All right. So we talked about a little bit about lymphatic massage. So that leads me, at least for me as the surgeon, to the next thing. So we've provided the surgery, we got the contour, we got swelling, we're manipulating the fluid out, we're making sure that we've got the right environment. Now we kind of lean into compression, and that's a big thing. On my end, I'm gonna tell you, it's like I just throw my hands up. I'm like, I don't know. And this is gonna sound bad, and I really do care. And Tay will vouch for this. I feel like I don't even care anymore. I just don't care. You can buy one, not buy one. I don't know. This is the one I gave you, and we'll see. I can't like, oh, it's too loose, it's too tight. I'm like, oh, girl,
Well,
you wearing me out?
So I can guide you.
Okay, so talk to us about compression. Talk to us as the community.
Mm-hmm.
Talk to surgeons about compression. I'm gonna let you run with it.
All right, so compression and the surgeon go hand in hand as far as relaying to the timeline of healing, the results, and the outcome of the procedure. What I have learned is not enough compression and too much compression can aid in immense swelling. So we really have to find that happy medium, and the person needs to know what type of garment that you need to use. As far as wearing a garment, which goes back to your previous question of the myths, there's a lot of conflict of how long to wear the garment.
Yes.
I hate to break y'all's hearts out there in the world, but if you want true, ideal, best results, you need to wear your post-operative care garment for 6 months to 1 year.
Wow.
Okay. What? As we know, right, it takes almost that time to get your true results after a surgical procedure.
Sure.
All right. So you have the bulk of your swelling the first 3 months. All right. However, because you're so fresh and inflamed, there's different types of fajas or body compression garments, stage 1, stage 2, stage 3. All of them are used respectively in the appropriate amount of time.
Okay.
Your stage 1 garment, that really is a short timeline, 2 to 3 weeks max. The material is stretchy. Okay. It's supposed to be a looser fabric.
Okay.
Just enough, but not too much of the amount of compression that you need. After that 2-week mark, then you transition to your stage 2 garment. If you can't do it in 2 weeks, which I was one of those people, I'll be honest, and I had to consult my post-op provider. She's like, you're not ready. That's what I tell my clients. If you're not ready for stage 2, fine. We can't force your body to do anything it's not ready to do yet. That's the hardest thing I have to get clients to understand. I know you got something you got planned, but ma'am,
yeah, exactly.
Because you know how that goes. Like, I don't know what to tell you. It's not going to work.
It's not going to work.
So if you get into the stage 2 garment, the material is not as stretchy. It is more compressed. The material lining of the garment is also more contoured. You wear that one, your stage 2, from the 2-week to the 3-month mark. Okay. After the 3 months, then you can transition to your stage 3. That is your maximum form of compression, because that garment has the built-in, we call them bones, like a waist trainer.
Yes.
So the top half is a legit waist trainer, and that baby does not move. It does not give whatsoever.
Okay.
And your body at that point can withstand that type of compression.
Got it.
And
Got it.
then with that, you continue that on. Now you can also use your stage 2 as a stage 3. You just go down to a smaller size, or you can get them altered as far as how long to wear them throughout the day. The first 3 months, you have them on for 23/7. So meaning you're only out of it for your massage to shower. You get back in it. You sleep
Got
in
it.
it as well.
Right.
After the 3-month mark, you want to train your body to not need the garment anymore, but that takes time. You want
Sure.
to look the same way with the garment off, then on.
Yep.
So then you start to wear for 12 hours a day. Does not
Okay.
matter whether you wear it today and sleep free at night, vice versa, as long as you have it on for half the day. And then
Okay.
those who are transitioning out of them, I say, okay, because sometimes they'll get so used to it, they don't feel right without having
Sure. Yes.
say
Yeah.
fine. Wear that one, the tighter one during the day, and getting your looser one at night.
Okay. Now, do you let them at that, on that stage 3 when they're trying to wean themselves off? Do you really let them wean themselves off? Like, I feel like I can wear the tighter one during the day and the loose one at night, and then I'll go to maybe just the looser one for 12 hours. You just let them freestyle it, or do you guide them a little
No,
bit? No.
no, we don't freestyle. We
Okay.
keep it pretty much at because your body will get confused. And that's
Yes.
what some clients don't understand. They're like, I needed a break. I didn't wear it today. Now you look 2 sizes bigger. Now you kind of set us back. So I have to have them understand we're weaning, but you got to stay consistent because the amount of time that you wear the garment in a type really can move us forward, or it can keep us right here and we not make any progress, or it can set us back with the swelling. So I like for them to stay on it as far as the type of compression. If you don't want to sleep in it, or if you want to be free for the other half or wear a smaller size, that's what we can gauge with. But as
Got
far as, picking days, doing this and that, no,
No.
you're just kind of going in a circle with your
Gotcha.
progress.
So I'm hearing from you, consistency is the key.
Correct. Correct.
And basically, if we kind of break it down, it's over a period of time up to a year.
Correct.
And we're going from initial surgery from looser to tighter to tightest.
Right.
That's what I'm hearing.
Yes.
Okay. That's great to know. From my end, again, we don't get compression 101 in surgery training. We're figuring it out. What I've learned on my end to kind of parallel that is that initially I was taught just by observing, and my mentors, they put people in tight compression. And I did that, and I got burned by creating a wound. And I was like, this makes sense. I've lifted up the skin, disturbed the blood supply. Now I'm going to basically tighten it, suction it, and then basically stand on it with a compression garment. The skin is really under assault. So what I've done is I backed off and right after surgery, just put them in a garment till I see them in 48 hours. I mean, a binder until I see them in 48 hours.
Yes, I was about to say that most time the binder is the best way for the tummy tucks.
Tummy tucks. Yes, that's what I'm referencing for tummy tucks. Just so that I can give that skin a chance to kind of catch its breath. And then,
I'm sorry to cut you off. A lot of surgeons want them to wear that for 2 weeks and then tell them to get into the garment. So I'm totally fine with that. If I see it's too much, because some will put them, like you said, in the 5. I'm like, no, I want you to get a binder. Just tell your surgeon we're gonna have to wait. You're not ready for that yet.
Yeah, and I agree. It's a little varies by surgeon to surgeon. I put them in that binder, and I usually wait for the drains to come out, which is for me is about 10 days. So the drains are not a problem with a garment. And by that time, I know if the skin's got a problem or it's going to be okay. So that's great information to know, because I think that's really confusing. Compression garments, fajas for clients and for doctors, because I sneak around on little boards here and there on social media and see what people are talking about, and I'm like, there's just a lot of information and it's not very consistent. So it's
not. So I understand how sometimes a client can get frustrated and confused because they don't know, who to listen to. And in regards to that, also, if the garment is too tight, you can get a faja burn. You can actually friction, it can be so
Yes.
tight and so much friction against the skin, you can cause yourself a burn from being too tight. So there's been clients that came in, and it happened to me.
Oh, wow.
I went to, I'm thinking, I'm all snatched up. I did the right
Right.
thing. I went to that appointment. She was like, no, ma'am, take that off. That's
Oh,
way too
wow.
tight. And see, they sold me something and had me thinking I had the right thing. And this was a
Right.
whole garment store where the people were supposed to be knowledgeable and know exactly how much compression I need. And that was a waste of like $200.
Oh, wow. Yeah. Yeah, that's why it's important, and I'm glad that's why we're here talking to the masses so they can get the right information from people who are properly trained. I'm not knocking anybody else, but we're properly trained and we stay in our lane. And that's why we need to get this information out. And on top of that, we're collaborative. We're not just working in a vacuum. We're working together for the benefit of the client. So that's awesome information. So now help me out. I'm going to take a little bit of a transition again. Talk to me a little bit about body wraps. Does that feed into compressive therapy? Is that totally separate? Help me out here.
Okay, so in regards to the cosmetic surgery world, what one will understand is that you spend the rest of your life maintaining the investment that you made with the cosmetic surgery if you care enough, right?
Right.
So the mesotherapy body wraps, that transitions on into body contouring. So like in the first 3 to 6 months, we're strictly post-operative care. Then we transition to body contouring services to mold and contour even more. With the body wraps, we make them extremely tight. But remember, you can't be too compressed fresh out of surgery or even in the first 3 months. So we do those things trickling out past the post-op surgical period of your healing. And we do that on the contouring phase where you're not coming to me as consistently. I only do wraps for people like if they have something coming up, right?
Yes.
Birthday or a trip or something along that line to give them that extra push to get into where they need to be. It is not in lieu or in substitution of a lymphatic massage.
Gotcha. Good to know. Good to know. It's a little spritzer. It's a little pick me up. Yeah. It's a little something for that next bit, right?
Correct.
Okay, awesome. Well, that's great to know also. So now I'm going to tie that into the next service. How often do you, and I guess it varies, how often do you implement your post-operative therapy? Because what I see out here from my purview, yeah, sure. Somebody comes in, they look a little dehydrated. You can give them post-operative fluids. That's very simple. But now people are getting, energy boosts, for lack of a better term, in that fluid in forms of vitamins. How often is that marrying with your whole program? And then the next question, if somebody isn't a post-operative surgery patient, are you offering offering IV therapy in general?
Okay. So to answer the first half of the question, that honestly is a case-by-case basis. However, what I do not like to see is getting IV therapy early after surgery.
Okay.
As we understand, we it's a lot of fluid manipulation already involved after having a surgical procedure. And you're already in somewhat of an overload, if you will, with expelling the fluids. So, there's things I need to know before doing an IV drip on you if you are fresh post-op. I'm not one of those people you can call randomly and I'm going to do it. I have a license to protect, and that's why there's such a gray area and so many unfortunate things that have happened with people having an IV hydration business. So much, in fact, that the state of Georgia has now cracked down and changed a lot of laws. So it has restrictions on me as well, on all providers who are not doctors, of course. And we have our independent practice. We now have to move differently. So with that being said, I would prefer to do it on a surgical client 1 to 2 weeks out.
I see.
There are some people that'll do it the next day and they swear up and down, I need an IV. It's really hard these days, as you know, to still be someone with all this wealth of knowledge and expertise, and they'll still listen to their friend.
Yes. Yeah, that could be
So I
what
just
my girl said. They didn't do that at her. I'm like,
right. I'm like,
oh,
maybe I'm not a provider for you.
yeah, yeah,
Because I'm
exactly.
not gonna do it if I don't feel comfortable. Of course, like
Sure.
you said, if someone presents dehydrated, sometimes surgery puts the body into shock. So yes,
Yes.
there are times where you do need to a fluid resuscitation, and I'm fine with that.
Yeah.
Probably not going to give you a whole liter. Again, it depends on how you present and your
Sure.
size, things like that. What type of history do you have? There's so many things that go into just hooking somebody up to an IV after having surgery.
Sure.
And then also on the other side, yes, I do offer those services to people who are non-surgical, but we go through a screening process as well to make sure you qualify to get it. Because again, just because you feel bad, I'm not doing lab work on you. I'm not getting a urine on you. I'm literally going by your word.
Sure. Sure. Yeah. Right. Right.
Right. Right.
Right.
So
Yeah. Absolutely. Well, that's awesome. So now, sounds like obviously you've got the full service now. If someone were watching this and they were like, "Hey, this is important information I didn't know," how do they get in contact with you? How do you engage with the client? Is it only through somebody like me? Do you get clients that come just kind of out of the, from your web presence or your video presence? How can patients kind of make sure that if they're thinking about cosmetic surgery, put you in the mix, so to speak?
okay, so my biggest actually form of promotion is word of mouth. I
Okay.
receive a lot of inquiries and clients from previous clients or people who know me and know what I do. Outside of that, also my social media presence on a Facebook, Instagram, and TikTok handle is at Nurse to Beauty. And then I have a web page as well, so you can Google me also for that. So that's the main way of getting in contact with me. Also, if anyone wants my phone number, it's 404-849-0260.
I'll make sure I put that in the comments below so that people can, when they look at this video, if they watch it delayed, then they can reach out to you for sure. Perfect information. So, last couple of questions, and we'll finish up. I thank you for your time. You've been so gracious. I really appreciate it.
Thank you for having me.
Um, do you get obviously clients from me or from other plastic surgeons who are patients are thinking about having it, so they've kind of planned it and
Mhm.
they're getting their ducks in a row. Do you get patients outside of that as well who've already had surgery from other doctors who didn't plan it and then they need to have something done? Do you accept those clients as well?
Yes, I do. So when they reach out, the first thing I ask is how far along are you and what procedure did you have? It's kind of half and half. Some will reach
Okay.
out right in that transition where they're commuting back home or their doctor cleared them to have massages. So then they reach out and then other reach out to me before. And then some are far out. They may have tried someone else, really, wasn't
Yes.
working. So they wanted to
Sure.
see what else was out there as far as options for their kids.
Gotcha.
So
Gotcha.
it's all over the
It's all
spectrum.
over. Okay.
Mhm.
Okay. So you take care. You take care of folks that need
Yes,
it.
I do.
Yeah. And that are a good match for you.
Correct.
Awesome.
Correct.
So now, do they come to you? You go to them? Tell us a little
Both.
bit about that.
So
Oh,
they can
okay.
either come to me. I'm located in Stone Mountain, or I do mobile services, just depending on the radius of the area. Try to keep it in metro area because it gets kind of conflicting with the traffic in Atlanta, as you know.
Right.
So it has to work out with who I already have on for the mobile, to be honest. But I am growing. I do have another team member that
Oh,
helps me.
awesome.
And if
Congrats.
I can't get to them, thank you. If I can't get to them, she can. She's wonderful. She actually did my post-op care, so I trust her
Oh,
with my
wow.
life.
Right. There you go. There you go. Awesome. That's fantastic. Awesome. Awesome. Well, is it anything that I didn't ask you that you want people to know about your business that we didn't cover?
I would say we covered a whole lot, the basics. What I really want the community to know is that it matters, A, if you have someone that has been through what you've been through. B, if they have the certain qualifications and certifications to make them legit enough to even take care of you. And C, someone who understands the emotional side. The mental side of it,
Mm,
I can honestly say gets dismissed a
yes.
lot
Yes.
from providers to family to friends to the internet. What I have learned is that's probably one of the most important things that's going to help you be successful along your journey is making sure that you're mentally strong to go through this, because there's so much misconception of how fast you heal and
Yes.
what you're supposed to look like.
Yes.
There's a
Yeah.
lot of people that, get upset and get
Yeah.
down, and they were not expecting this process. So now
Exactly.
I'm having to talk to you. I'm the only, person that is having to explain, hey, this is actually how it's going to go. It's not going to be tomorrow. It's
Yeah.
going to be a few months before you get back to yourself. And it also made me respect and start to acknowledge post-op depression.
Yeah.
It is just like postpartum
Absolutely.
depression. And I unfortunately had one client was so severe that, she had other mental factors, but she expressed suicide.
Oh my
So
goodness.
yes, after her, I do a full mental assessment. I always ask my clients, well, how are you feeling? Because we
That's
got to
awesome.
talk about it. And you know, sometimes it could be embarrassing, right?
Sure.
Because this is elective. No one takes it serious and they think
Sure.
their family member, a client, patient's overreacting. They're not. They may actually be having a mental crisis, and we got to pay attention to that and make sure that they are mentally capable enough to continue to go along this process so they can heal the way they need to.
I totally agree with that. I think that's something that's not talked about
Yeah.
enough. We can talk about it in general, or this our general state in the
Mhm.
world. We are under mental duress and stress.
Correct. Correct.
When you add other stressors on top of that, even though
Mhm.
you want to do it, it's
Mhm.
a process, and
Mhm.
you undergo kind of ebbs and flows in your mental health well-being. And
Right.
as far as we're concerned as practitioners, we need to be sensitive to that and
Mhm.
recognize that. I can tell you a lot of times I see patients and I walk in and I spend a lot of time with my folks and we build relationships. So I know when they're good and I know when they're
Mhm.
not good. And I just look at their demeanor, I go like, hey, what's going on?
Yeah.
Yeah, what's happening? And we have good enough relationship they can kind of tell me, but you gotta be clued into that. You can't
Mhm.
just be this doc that walks in, yeah, everything's good. My nurse will see you.
Right,
Now,
right. And some of them will like
no.
break down crying because I'm
Yeah,
the first person to ask them, well, how are you feeling? And like
yeah,
they're trying to explain. And then that's when I'm like, okay, you have a little bit of depression, but
yeah,
that's normal.
that's okay.
The act of liposuction
Yes,
creates that suffering and loss. So it's actually a very normal thing. And what I tell them is as your healing progresses, as you start to feel better, you move around, and especially when you see your results, it goes away. Like 10
absolutely.
times out of 10, that is a very small window of time that
Absolutely.
the client is experiencing that.
I agree. And then what I tell them, and I'm sure you do as well, is that we're here.
Mhm.
We're here for you. We're here for you to support you through this,
Correct.
good, bad, and indifferent. So that's why we're here. So
Correct.
I agree. That's one of the things I think just doesn't get talked about enough, and I'm glad that you brought that up. So.
Thank you.
Well, I think we come about to the end. We've been on here about 45 minutes. I can't believe it's been really good. And I hope that people get a little tidbit of something out of this.
Mhm.
I think what I want to echo on these issues about cosmetic surgery, plastic surgery, pre-op, post-op, and in between. This is serious business. This is
Yeah.
serious surgery. It's something that can be life altering and
Mhm.
certainly positive, but it's not what you see on Instagram posts. You're seeing when it started and when it was at the end.
Mhm.
You're not seeing the middle, and you
Right.
have to appreciate that.
Right.
So this is serious business. We're here to help Tay and myself to help guide you through that. So I hope people get that tidbit of information. So on that note, I really thank you again for your time. I
Thank
do want
you.
to do one thing.
Okay.
I follow a guy, not many people may know him, named Stephen Bartlett. He's a guy in the UK. He's 27. He's very wealthy. He just had a good stroke of fate, but he grew up very poor. But he
Mhm.
has a great podcast, and he talks about all things in the world. He's a very interesting guy. But he asks his guests a question at the end of his interviews, and I want to do that. I want to ask you a question. It's usually left by a previous guest. Our previous guest was probably about 6 or 8 months ago, so I just pulled up a question.
Okay.
So the question I have for you is pretty simple. Taking money out of the answer,
Okay.
how do you measure success?
Oh, the look on my clients' faces.
Oh, awesome. Okay.
When they first come to me, they're down bad, as they say. Like,
Yeah.
you know,
Yeah. Right.
they're in need of a lot of help, a lot of TLC, you know. For me, the difference between you and me with our practice, I see them on a more regular basis. There's some I'm
Sure.
seeing every day. You know,
Sure.
I'm talking them through those moments that they're having. I'm, probably meeting their kids or husband if I'm coming to their home. Like,
Sure.
you know what I mean? We become very close, almost
Yes.
like best friends for a minute
Yes.
because of the time that we're spending together. And then to really see their transition, they don't see it, which is why I encourage them to take pictures. So to see them come in and now you're dressed up, you got your wig on, your makeup on, like you just came for an appointment. I'm thinking you
Right.
had supposed to be. No, you're
Right.
here to see me. I'm like, oh, okay, girl. Like I love seeing how it grows and they get their confidence. That lets me know that I'm doing exactly what I'm supposed to be doing, that this is my lane and my field. And that makes me feel successful, that clients actually really appreciate me. And it brought my passion back for nursing again.
Oh, that's awesome. Great answer. I appreciate that. So, again, I thank you for all the listeners out there. If you have had surgery already and you don't feel like your post-operative or your recovery is going well, reach out to Nurse Tay. We'll put that information down in the comment section. Please reach out to her. She can give you some good advice. It doesn't hurt to listen and to talk. And you may decide to do something differently, but I would advise you to move forward with her. Again, if you're thinking about cosmetic or plastic surgery and you're planning and you're a planner, you need to implement some type of recovery plan. And again, Nurse Tay can help you with that. So once again, I really thank you. I hope you have a wonderful evening.
Thank
And
you.
God
Thank you
bless
so
you.
much
I
for having
appreciate
me.
you.
I'll
Okay.
talk to you soon.
Talk to you soon. Okay.
Yes.
All right. Bye-bye.
All right.